Okay, let's start. Okay. Bismillah ar-Rahman ar-Rahim. In the name of Allah, the most gracious, the most merciful. My name is Al-Mu'tasim Hassan. I recently passed the MRCS Part B OSCE exam, and my exam was in Abu Dhabi last December 2024. I want to thank Mr. Ali and Mr. Muhammad for giving me the opportunity for reflecting my personal experience regarding MRCS Part B, hoping that all the candidates are taking the exam would get the benefit from it. Uh, I'll try to be more informative in this presentation. So let's just start. Um we'll speak first of all in general about the MRCS Part B OSCE exam. It's a clinical examination, as we know, and it's conducted by the all four Royal College of Surgeons, the Royal College of Surgeons of Edinburgh, of England, of Ireland, and of Glasgow. And most of the exam are the same nowadays because they are following the intercollegiate system. Uh, and the common intercollegiate system in London is responsible for conducting the examination all over the world. So there is no difference between the four colleagues, and the preference between these four colleagues comes from personal basis. Actually, some of the candidates wish to be a holder of the membership of Edinburgh, while the other are wishing to be a holder of England, but they are the same eventually. In general, there are four attempts allowed for MRCS Part B OSCE exam. If God forbids that the candidate would not pass after the fourth trial, he or she has to repeat the MRCS Part A from the beginning. And we hope we'll not get to this point. The exam is consists of two blocks, mainly the knowledge block and the skills block, and all are conducted in a circuit of 17 stations, taking about 6 hours in duration. And the pass in each of these branches is required for an overall success in the exam. Next, please. So, regarding the knowledge block, unlike the MRCS Part A, the MRCS Part B OSCE exam is concerning the application of the basic surgical sciences, mainly the anatomy, the physiology, and the pathology in the clinical practice, while the MRCS Part A is responsible in just discussing the basic and clinical facts, frankly. But MRCS is they are testing the implication, the ability of the candidate for implicating an application of this science in his clinical practice. And these in the exam, they come in three stations for anatomy, three stations for physiology and critical care, and surgical pathology comes in two stations. Next. So regarding the skills block, it also concerning the application of the basic surgical skills in the clinical practice in two stations for surgical procedures, two stations in history taking, and three stations in clinical examination, and two stations for communication. One of them is the phone call, and usually it's presuming that you are speaking to a senior or a colleague in the medical field for discussing a referral, planning, or opinion, according to the given scenario, the exam. While the other station in the communication will be a doctor-to-person station, and usually it's discussing your ability for counseling, consenting, and obtaining DAMA or LAMA, and according to required scenario two. Next, please. So, um, mainly we'll speak about my journey on MRCS and my personal experience in this journey. I cleared up the MRCS Part A on February 2021. And between 2022, I tried many times uh, for clearing up the MRCS Part B. And the last time I passed was the last fourth trial or attempt for me. So Alhamdulillah, everything went fine and I passed. My first trial was in Dublin, the Royal College of Surgeons of Ireland, May 2022. In Bahrain, my second trial was in November 2022. And the third trial was in Abu Dhabi, the Royal College of England, in August 2023. And the last one where I passed was in Abu Dhabi last December 2024. And now we're here for discussing my experiences about each exam. So, my first trial in Dublin, 2022, I failed for many reasons. One of them that I was not fully aware about the exam. I'm not prepared well. And the first thing I discovered that the UK and Ireland um, centers are concerning the communication mainly. Um, and as a general advice, the UK and Ireland centers are following the standards strictly. They are following the standards, um, comparing with the overseas centers. While in my second trial in Bahrain, the exam really was tough exam, and it's a famous exam. And because of this exam, most of the candidates are running away from Bahrain exam because the Bahrain Center has a bad trouble among the candidates because the examiners are tough. And also, besides these reasons, I had personal reasons. I was very exhausting because I was covering a duty. I'm living in Saudi Arabia, by the way. So I covered the duty and directly traveled to Bahrain. So I couldn't find the time to rest and sleep well prior to exam. And that's why I failed in this exam. In Abu Dhabi, 2023, I was about to pass, and I failed because of one mark in knowledge station. Um, Finally, I passed and I made it, alhamdulillah, on Abu Dhabi, in December 2024. And we'll discuss all of these reasons and on my next slide. Next, please, Dr. Muhammad. Next, please.
Muhammad, I think you skipped one stage, one slide, the
Yeah,
on the
yeah,
previous.
yeah.
Yeah,
He said next.
Yeah.
yeah,
So,
this one.
yeah.
So I'll start by my last exam, and I'll give it. There is a noise background.
Yeah, so someone is opening his camera and he's let me see who is this.
Yeah.
Yeah. Samawal Abdul Muhsin, can you please mute yourself?
Let me
Samawal.
mute him. Let me mute him, please.
Yes.
Yeah, you can continue, Muhammad.
Okay, thank you. So I'll discuss this exam and try to show our candidates, especially the beginners.
I just want to wait
Uh,
before you do that. I just want to make one thing. If you can, Muhammad, please don't give like exact situation of the exam, as this is not allowed, and this is recorded. So don't say exactly which station came on the exam.
yeah, exactly.
Yeah,
Okay, I'll not speak about this.
yeah, fine.
Sure. So my exam was a PM exam. That the day of exam, they divide the candidates into morning for the morning time or AM shift and PM shift. So my exam was in a PM shift. Um, you'll come inside the exam after finishing the check-in. You will find you will have an introductory session where the senior examiners will come and speak to you about the exam and discussing the rules and everything. And after that, I will divide the candidates into two groups. One will start with the skills, and one will start with the knowledge. And At the middle of the exam, the two groups will exchange and take the place of each other. Between the two blocks, you will have a break between 20 to 30 minutes. They will introduce some vegetables and some coffee in preparation for the next block. I guess I want to draw our candidate attention to that these breaks differs from center to center and according to exam organization. After that, I went to the skill stations. After the exam, after 6 hours of finishing the exam circuit, you will have a meeting with the examination with the examiners. They would ask you about the feedback and the concerns. That's it. We'll hold the discussion, further discussion as required by Mr. Ali. Next, please. So I'm here for this important for tips and tricks. That's why I'm here today by the request of Mr. Ali and Mr. Muhammad for showing my experience and give you some tips and tricks that would help you in preparation for the exam. Next, please. So we'll go for the tips and tricks in preparation. The studying of MRCS, you have to take it seriously and it requires consistent work. And the main taking home message is practice, practice, practice. All the time you have to keep practicing. Don't delay the practicing for a short time before the exam. Once you start studying, you have to study practice because the only guarantee to pass is practice. As much you practice, as much you are making the possibilities to pass this exam existed. And in practice, you have to pay an attention to make this practice is a balanced practice between the knowledge and the skills. It's not accepted to practice knowledge more than the skills and vice versa to practice skills more than knowledge. Because as I told you, you need to pass in both of these branches for an overall success, inshallah, for all of you. So you can use the recalls and feedback, the previous calls and the feedback. The media is stuffed about this, but not only as to determine the frequency of the station come, but you need it also to take it as a real exam. I remember on 10 to 15 days prior to my exam, I used these recalls as a true exam. With my partner, Mr. Abdul Hamid, we tried to practice all these recalls as real exam by time and in the same real exam situation. It will help you a lot to throw out the fears. It will help you a lot to prepare yourself and make your mind sharp and to recall the information in a short time. And you need to also to expand your knowledge if you would have a time, because nowadays they start emerging new questions in the exam. I can tell you that they will not go out of the scope of the stations that you will have, but you need to expand your knowledge for a little bit more, just in case if we ask you new questions, it will be in the same scope. So you can expand your knowledge through readings online, Googling, or you can use artificial intelligence. It's helpful also in this. And one more thing, you have to be more specific and organized in your answer. For example, in enumerating or enumerating questions, you need to prioritize the answers, make them more specific, more segregated. For example, if it asks you about a complication of something, you need to start with the more specific complications, then go to the general complications. This is a likable way of answer for the examiners. Next, please. So for the exam day, the big day, my biggest advice for you, sleep well, sleep well, sleep well. I repeat it 3 times because when I sat with myself before the fourth trial, I found that one of the causes for failure that I spent most of the night studying and I didn't relax well. So you find yourself by the morning of the exam, the day of the exam, you are exhausted and you lost your concentration. So please sleep well, at least 8 hours before the exam. Have a good meal because you need an energy, you need energy for this long day. As I told you, it's 17 stations. The long circuit will take 6 hours. So you need the essential energy for your brain and your body to face this. And the most important thing is to stay calm. You have to stay calm and be quiet because anxiety and stress will harm you. And you may lose all of your efforts among the months you spend in preparation for MRCS because of the stress, because of the anxiety. So please stay calm and dress elegantly and be simple. And I saw in the media many questions about the dress code. It's very simple. You need just to be elegant, a formal pant with a formal shirt, put your perfume, and wear an elegant shoes. And they need to roll up the sleeves above the elbow. This is the dress code for the male, and for the female is the same. They don't object about for the head cover, and wear something comfortable because, as I told you, you'll spend a lot of time. So wear something comfortable for you. Um, and put a title for that day that you will fight for every mark. You'll fight for every mark because I told you I failed on my last trial by 1 mark difference. You can't imagine. 1 mark difference can make a difference. So that's required for you a good preparation to be able to answer any question and try to gain the maximum mark from each station. And one important issue inside the station, you have to manage your time. When you feel yourself that you are struggled in a question uh, and you are off point, or you feel that you need a time to remember, just say pass. And the examiner will move you to the next question to avoid time loss, to avoid loss of time. It's very important actually, and it helped me. So remember pass. When you're not able to answer the question, say pass. And it's better to lose one question than better losing the whole station. And especially in skills stations, you have to use all the provided resources. By stress, you may forget that they will provide you pencils and papers. They are very useful in the exam for taking points. Although I follow Mr. Ali advice, especially in history, you need just to take the history by your mind and keep the eye-to-eye contact with the actor or the patient because you need these marks in communication. But on the same side, you can use these resources for demonstration and drawing. This is would leave a good impression in the examiner when you use these papers and pencils for demonstration, especially in counseling and communication stations. Uh, and this advice is important when you finish on the station, even if you perform bad in this station, never think about this station while you're performing your exam. This is very important. This is very important. When you finish on the station and get out, never think about this station. Leave it behind and go to the next station. It's very important for me. And on the first trial, I did bad in many stations, and a lot of bad ideas was jumping on my mind throughout the exam, and eventually I lost my concentration. So it's better to leave every station you did behind. Never think about. Next station, please. So a lot of the candidates are caring about the facial impression of the examiners. I heard about the feedback about this. The examiner was angry, the examiner was shouting, The examiner was must face, so never pay attention for this. It's one of the strategies to distract you. So it's better to put all of this aside. And the examiners, they have many strategies. They are focusing on testing your deep understanding of the facts, as we said, about the knowledge, about your knowledge, about your skills, about your communication capabilities. So, and as we said, the examiner eventually is a human being. Maybe he went to the exam in a bad mood, and of course, it will be reflected on his behavior, but it's not important at all. Even if it's shouting, keep quiet, it's not your business. Just focus on your patient, focus on what you are doing. And for communication, especially for communication skills or any station that would require an interaction with the patient, forget the examiners. Just imagine that you and the patient are inside the rooms. There are no examiners. Just do your work probably. Just do your work properly and forget everything. Forget atmosphere. And the new tactics are following nowadays. I noticed that you studied. I'm sure that you will study well, but they started to rephrase the question. The same fact you studied, but they start to present them in new sentences, and they are playing with the language. So just as much you keep the information stick in your mind, you can answer it in any way that would be asked. So never get panic if you hear the exam, if you hear a question which you will feel is strange. Just tell yourself that you know the answer. Just focus and concentrate, and I'm sure that you will get the answer. So don't worry about this. And one important thing I noticed of my examination is topic interconnection. For example, the fact of atrial fibrillation. I've been asked about atrial fibrillation for about 3 times in the same exam. So the examiners may divert you in a topic, in another topic, and turn the discussion toward this issue. That's why I told you that to keep all the information stick in your mind and easy to be recalled at any time. Um, they start also to introduce new questions, but roughly I can tell you that it's not an issue to make you afraid from the exam. Roughly, I can tell you that these new questions will not exceed 10 to 15% maximum from the net of the exam questions. Next. Yeah. So I have some points to consider from, and I added this slide recently among my preparation for this PowerPoint, because there are a lot of discussion about this point, especially among our friends of Sudanese candidates. The preparation time frame usually takes from 4 to 6 months, but it differs from a person to person. There are personal variation. This work and the environment, the time you can, the leisure time or the free time among your day for studying. For me, I talk about the first time I talk about 7 months in preparation because I was stuck on my work. I serve as a vascular resident and our hospital is overcrowded, so it took a lot of me in the first trial. But eventually, on the last, you can finish the curriculum, but it's different from one to another according to the situation. It's personal and it's hard to judge. But start early, start studying early. When you're concerned to engage in MRCS, start early and book when you are ready. Don't book and then you will decide to start studying after booking your examination. I think this is a big mistake because, as I told you, surprises are happening in our life, especially nowadays in Sudan because of the war situation. We are struggling sometimes because a lot of problems we can experience in our life. So my advice, as I told you, to start as early as possible. And for the center, which is a big issue and had a large space of discussion between our candidates. Um, for me, I think it's better to consider many points like the nearest center for you, the geography, the logistics, the financial situation. And one of the important issues I noticed in my exam, the visa. Actually, a lot of Sudanese candidates unfortunately couldn't attend the exam because of the visa. So in Sudan, and our candidates in Sudan, the nearest center nowadays is Egypt, and because of the security issues and security check, a lot of our candidates would find it's difficult to get the visa. So it's very important to consider this point. Um, Withdrawal. Withdrawal, actually, we noticed that I noticed that most of the candidates had withdrawn from the exam because of a lot of reasons, personal reasons, the visa reasons. Actually, it's not a recommended option. And I think it's better to choose the accessible center for you. I'm afraid in the future that nowadays they may find an excuse for us as Sudanese because of the current situation in our country. But I'm afraid that in the future they may take an action basing on bad impressions and I remember that the examiner spoke about this. Uh, there is a background. There is a background.
Muhammad, mute him. Muhammad, mute him. Yeah, you can continue.
So eventually, on deciding on booking, don't book in any center, the next available center. You'll find a lot of centers available for booking, but you have to consider all of these points. Choose the accessible center for you. That's accessible geographically. That's the visa is achievable, and then considering the other logistic and financial issues, as I told you, and follow the college rules and regulations because the withdrawal is a loss, is a lose. You will lose a lot of money because of this withdrawal decision. So it's better to set up your mind before booking for the exam. Next. Yeah. That's all for me so far.
Very good
Actually,
presentation, Mu'tasim. Nice, very
thank you.
cool. Congratulations and thank you for this amazing presentation. And of course, you're giving us a permission to publish it, right? You're okay with that?
Yeah, before this, yes, I had a discussion with Dr. Muhammad. I'll do some adjustment before allowing to share it.
No, I mean the video. The video.
Yeah, the video don't mind. I don't, yeah, I don't
Yeah,
mind to share it.
it's a very nice one. I just wanna mention 3 or 4 points before we go to the question. I want to emphasize on what you said of sleep hygiene, and in order for you to get your sleep hygiene right, it's not just the day before the exam. You need 7 days to sleep at the same time and wake up at the same time. You sleep by 9, 10, 11 maximum, and then wake up by 7 or 8 a.m. in the morning, maybe 6, and keep this routine for 6 or 7 days. On your exam day, avoid sugar, avoid high sugar meals because this may lead to rebound hypoglycemia. You will eat sugar, your insulin will raise up, and then you will be hypoglycemic. So
So
avoid.
Snickers 2X is a big joke for the exam day.
Yeah.
Don't eat high sugar content food.
Yes, exactly. Eat like banana, starch corn, oat, something that has a lot of fiber, any type of the fruit. You said examiner face. I like you when you mentioned that your examiner is trained to be a mask face. He will never give you, like, your examiner will not say you performed well or you performed bad or you performed good. So they are trained not to give a fast face impression. And I also, during my exam, one of the station, I had it with a Russian examiner. I couldn't understand nothing. It was a pathology station, and his accent was so heavy. I think I failed that station because I couldn't understand what he said. But at the end, I passed the exam. but I think they gave me 0 on that station. I couldn't
That's
understand
what.
it.
That's why never think about the station you
Yes,
perform.
exactly.
One
Yeah.
station will not fail you.
Yes, exactly. And if I didn't follow what you said, like I think on that station, maybe they didn't count it for the exam. I'm not sure, but he was having a like his accent was so heavy. I couldn't understand what he's talking about. So expect that also on your exam.
Yeah,
And I
the
think a
Indian
lot, yeah, yeah,
examiners also have the bad accent, so you have to
yes,
focus on that. Yes.
cool. I will. Okay, questions. Who wanna ask Muhammad any question? Open your mic and ask your question, please. Especially for those taking the exam in Abu Dhabi.
Hi, thank
Yeah.
you for this very informative session. I just have two questions. Number one, when to attend the hands-on or these sessions or courses, or is it mandatory for me to attend these such courses?
Yeah.
Number
Mhm.
Yeah.
Okay.
you can answer this and then I'll ask you the another question.
Yeah, actually, regarding the hands-on, it's variant from person to person and depends upon the availability of the hands-on courses on your area. But it's better to be engaged as soon as possible so that you can have an idea and you will have a chance for practicing if you can to be engaged in one of these courses.
Yes. Can I add something, Muhammad?
Yeah,
Al-Mu'tasim.
yeah,
For hands-on, unfortunately, most of the hands-on done before the exam, like 1 week before the exam.
in a
I
short time. Yeah.
Yes, I wish if the hands-on will be done like 1 month or 2 months before the exam. I think that will be
Yes.
more informative. I didn't do hands-on. My brother Muhammad didn't do hands-on. I'm not sure if Mu'tasim done hands-on or no.
I had
But
one long time ago on my
okay,
third trial. Yeah.
yes. So hands-on are informative if they have done earlier, like 1 month
Hmm.
before your exam, not just 1 week before your exam. I think if you've done it like 4 days before the exam, that won't be helpful. If
Hmm.
if you used to practice a lot, like if you are practicing day after day with someone, you're practicing examination procedure skill and you're recording yourself and you seeing yourself on the record, I don't think you need the hands-on. If the hands-on your city and you don't need to travel to another country for it and it's affordable, then it's a good choice. But if it's very expensive and you cannot afford it and you need to travel for it, I think yeah, you can just practice with someone and review your practice while you're
Yeah.
recording yourself. Yeah.
Yeah.
Okay, that's very clear. Thank you so much.
Second
Mhm.
question.
What
Yeah,
is the second question?
the second question is something technical. I just wanted to know whether the examiner will stop me after 6 minutes in the history or something in the
Yeah.
station. I mean, yeah. Or should
Yeah.
I just stop and jump to giving him a summary or something like that after? I don't know whether
Yes.
I have a watch or not. I don't know.
Yeah.
Yeah.
There is a counter. There is a counter, and you'll hear the sign that after passing the 6 minutes that you have to stop. Wherever you approach in your history skeleton or examination, they will ask you to stop and summarize. That's why I said many times, practice, practice, practice. I practiced hard to finish the station within 5 minutes and 30 seconds. This is the best I could to do, and it was very helpful in the exam. Because in the exam the time is very tight. You have to do everything subconsciously, and which require practicing. And at the time, believe me, by practicing, you will find that you can do it in a shorter time, that even that shorter than 6 minutes.
Yeah. Can I add something also? So
Yeah,
on the exam day, there will be a bell, like the bell will ring, tick, 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 which means that 6 minutes passed.
yeah,
The bell will ring if you are doing history, if you are doing examination, if you are doing communication, whatever you are doing, it's gonna ring after 6 minutes. You're gonna hear it.
yeah.
That means yeah.
In my exam center, there was an overhead. 6 minutes has passed.
Okay, all right.
Yeah,
That's another choice. Yeah.
Yeah.
So you have two choices. Someone will tell you 6 minutes passed, or you will hear the bell ring, and then again they will tell you to move to the next station.
Yeah.
Okay, great. Thank you so
Yeah.
much.
Yeah, most welcome.
Questions?
Hello, I do have a question.
Yeah.
So although a completely new station is not quite common, I would like to ask, how is it common, or what is the odds of them having a different differential than the differential that we do have on the sheets that are available? For example, a limb claudication in the station, it's more of vascular. So what are the odds of them to present a neurological claudication, for example?
Mm-hmm. Yeah, first of all, I forgot to add a point that deal with every station as anticipated to come in your exam. I forgot this issue. It's very important issue. You have not to ignore any station as it's not infrequent and it's not infrequent and it came long time ago. You have to take all the stations seriously. Regarding your question, as I told you, you have to be specific in your answer. This is upon the response of
Mu'tasim,
the
I'm
upon
sorry.
the
We have less than 1 minute. We will create a
uh-huh.
new meeting, okay?
Okay.
Yeah, so everyone can join back to finish the question and answer. Okay, Muhammad, create the meeting and distribute it between the group. Prepare the screen and
Yeah.
PowerPoint, and
It maybe
see
takes
you.
2 to 3 minutes to initiate a
Okay.
new meeting.
Okay, 2 to 3 minutes. Let's
Okay.
meet you again, guys.
All right. Question was about the formulating of the differential diagnosis. And as I said, you have to be specific in your answer. And this requiring a lot of practice, as I said. In practicing, especially during history, during for the history and for the examination stations, try to modulate the findings to be directed to a specific diagnosis and change this diagnosis from a time to time. By this way, you will make your mind flexible, and you can generate the differential diagnosis or recall the facts according to the station provided. So again, practicing and be organized.
Yeah.
For example, if you had a station about, as the doctor said, how to differentiate between the intermittent claudication and the neurological claudication, for example. Sorry, Mr. Ali, for speaking specifically about this point. But
Yeah, that's
for
the general information. Yeah, that's fine.
general information, yeah. So as you know from the materials that the intermittent claudication is a vascular, can be a vascular or can be a neurological claudication. So in the history, if they would direct you toward the vascular claudication, they would give you clues. This intermittent claudication is vascular. For example, you will find risk factors for vascular disease like to be a smoker, to be hyperlipidemic, to be a diabetic. And you will find also some chains, skin chains, ulcers, or sloughing. And of course, you will ask about this. So you will set in your mind that this is a vascular claudication instead of neurological claudication, because the actor will deny any neurological manifestation. So it will be clear for you that it will be vascular claudication. So you're sitting at the top of your list. Then you'll go for the other possible causes.
Can I add one thing? Can I add a critical? Yeah.
Yeah.
So I think Hayat asked that question. Hayat.
Yeah.
Okay. I will give you not a mnemonic, but I will give you an example. I think about history examination and communication skills as a meta skills. So it's like, if you mastered how to speak, how to take permission from the patient, how to ask the questions, how to generate a differential diagnosis according to the presentation, That's all what you need. It's like driving a car. If you know how to drive, it doesn't matter which car you're gonna drive. You can
Yes.
drive Toyota today, you can drive Hummer the day after, you can
Yeah.
drive a different car the day after. So it's how you present yourself, how
Yeah.
like the examiner is not like the examiner is looking at you as a whole. How
Mm.
do you speak? How do you communicate to the patient? How do you present yourself? How do you present your patient? It's not like if you missed one differential diagnosis, you're gonna miss the mark, or
Yeah.
if you didn't mention all the differential diagnoses, you're gonna no. Like it's a general present. It's your general presentation, and this exam, the like after we passed it, and after we taught a lot of people how to assess the exam. I think it's more about the presentation and it's not about the knowledge in your head. That's
Exactly.
why, as Mu'tasim said now, it's about practice,
Mhm.
recording yourself, see where do you say so when you repeat
Yes.
your questions, and
Yes.
how you eliminate the disadvantages and you eliminate your mistakes. Don't be stressed. Don't be too stressed about what if I miss that. If you miss the station at all, like let's say that your station was neurological claudication, and from the history, you presented it as vascular claudication, peripheral arterial disease, or chronic limb ischemia, or acute limb ischemia, or whatever. That's not the reason for per se for you to fail. If you took
Yes.
a took appropriate history from the patient and you became sympathetic, and the patient said, "My dad passed away," and you say, "Oh, I'm really sorry, Mr. John, for your dad loss," and you did all of these, they will mark you for all of this. They will give you a mark for presenting yourself. They will give you a mark for taking permission. They will give you a mark for mark for professionalism. They will give you a mark for asking about different part of the history. They will give you a mark for discussion. They will give you a
Mhm.
mark for differential diagnosis. So don't be
Yes.
stressed if I miss the day. No, it's not about missing or getting the diagnosis. If you get the diagnosis right, let's say
Mhm.
you got the diagnosis, it was a very rare condition, and you get the diagnosis right, but you didn't introduce yourself and you didn't take permission, you're gonna fail the station. So it's not about your clinical knowledge. It's not an MCQ's exam. I hope
Yeah,
that's
and I want to add one more thing, Ali.
yes.
We asked the senior examiner about this point. He told us it's not a big issue for us to know all the facts you just mentioned.
Yeah.
Their main purpose is just to test your approach toward this patient. They don't
Yeah.
care much about the clinical facts, by the way.
Yes.
Yeah, just
All right.
they're
I I
testing
I I I hope that
your
I hope that
approach.
will give you some perspective. I think Hayat asked the question, right? I want her to reflect on what we did we say it
Yeah,
clear? Does she want
yeah,
more clarification?
Yeah, thank you so much. It
mm,
it is clear, although I would ask, I would
Yeah.
like to add some question. So my main focus is while preparing, I meant the discussion questions. For example, the templates we do have, the example
Yeah.
I brought, the templates or the sheet direct us toward the vascular claudication, and we do have the investigation and treatment for this.
Yeah.
I meant, how much
yeah,
important is it for me to go and read about the investigation and treatment for the other differentials?
Oh,
yeah.
yeah.
It's
Okay.
very
So
yeah,
yeah, yeah,
yeah, yeah,
yeah. I will let
yeah. I
Muhammad.
think yeah. Thank you. I think yeah. You shed the light on an important issue. Yes, after finishing the discussion of the main issue, if you have the time, you can also shed the light upon the management or any relevant point to other causes. This is a good idea to give the examiner that you are aware enough about all the other facts, not only the main diagnosis. This means that you are not only a saver for the question, but you approach the patient on the right clinical way. So after finishing the management of the vascular claudication, for example, you can speak quickly about the neurological claudication or other causes. But by the way, it's 3 minutes. It will be a quick discussion. As I told you in the skill station, they're testing your clinical approach rather than the knowledge approach. Yeah, Ali.
Yeah. Yeah. So if you said, let's say your patient has spinal stenosis, and let's say you had a limb claudication, and you are confused between spinal stenosis or peripheral arterial disease, which is presented with intermittent claudication, as everyone knows. In order for you to say that's a vascular, you need if it was a history station, you will not be able to diagnose from history station, except for spinal stenosis. They usually get better by walking uphill. Their stenosis will be relieved a bit, but that's not clinically significant, and it differs from a patient to patient. Unless you do an examination, unless you take the pulse for dorsalis pedis pulse, and then you find no dorsalis pedal pulse or no popliteal pulse, you cannot differentiate between vascular and spinal stenosis, peripheral arterial disease and spinal stenosis. And also, you may request a Doppler ultrasound, and then you may do CT angiogram to make sure it's a vascular in origin. That's for the
Yes.
examination station. If it was history station, there's no way for you to investigate. And either way, in order for you to diagnose spinal stenosis, you need to exclude vascular problems, peripheral arterial disease. So if you mention the vascular investigation, including the ultrasound, Doppler, and CT angiogram, and then ABBI, if needed, ankle brachial index, that will give you the mark, Hayat.
Yes.
So
Yes.
so don't be too stressed of mentioning the other differential. If you just mention investigations, any investigations for any of the most appropriate diagnoses, that will be more than sufficient. It's 3 minutes. You're going to present in 1 minute.
Yeah.
They will ask you about the investigation. It should be like 40 seconds or less. And then they will ask you for the treatment, which is going to be 1 minute. So
Yes.
don't waste your time. Long story short, don't waste your time going and reading about other differentials investigation. Memorize the set of the investigation that's written in most of the time sheets out there, and say them on the exam day. That should be sufficient. If your examiner asks you how to differentiate between this and this, then you can expand more. But don't voluntarily say it.
Okay, thank you so much.
You're welcome.
Any other question?
Ali, I think Mu'tasim have something to say.
Yeah.
Before that, is there any question?
Yeah.
Mu'tasim, I'm so glad you finished with your job now. And I would just want to say thank you. And it's obviously all the people are interested in this presentation. It was a nice one, very organized one. And thank you for that.
Yeah. I just want to add one point, and it's very important. After thanking you and Mr. Muhammad for your efforts, I think we were the first batch in medicoplasty at school.
Yes,
Yeah,
I
that's
remember.
yeah. You remember me and Salma Zahran and a lot of these people. Alhamdulillah, all of them was passed. Yeah, my
Yes.
question is why medicoplasty and school? For our candidates, medicoplasty and school I found them very useful. And honestly, yeah, I depend upon the materials, but I expand my studies as I told you.
I just
B-
want to say something. That's a free advertising, and I didn't ask you for it, Muhammad.
yeah, of
No
course.
problem.
Yeah, of course. Yeah, of
Yeah.
course. But this medicoplasty will provide you a good community for studying and a good tutors, Mr. Ali and Mr. Muhammad. And hopefully that in the future, this team will grow up and expand to, and it's very helpful, especially for our Sudanese candidates nowadays. We know that the courses, there is a big competition and a big war between the course, MRC's course provider, and by this time, medicoplasty has been born. And I think, as I told you, it provides you a good society for studying. Most of the people are sharing you the same target. So you'll find a good community for practicing. Ali and Muhammad are administering a good practicing session, and they are very creative and very encouraging for their candidates. And
Yeah,
they follow you. They follow you personally, Ali. Especially Ali, I kept in contact with him. And if
I
you check
remember
my
this.
WhatsApp, nobody knows about what
Yeah,
happens
so
behind
Muhammad,
beside the scene.
I just
Yeah.
want to add one thing. So our mission is in the Medicoblasti, we just want to make it as free as possible, as low cost as possible, and help
Yes.
as much people as we can to pass the exam easily.
Yeah. One
Because
more thing
we
that
know this
Ali.
exam is a struggle for most of the people, and courses are on the high prices. So we are providing value, and that's what
Yeah.
we're going to continue with.
And one more thing, you'll find all the materials, most of the materials, more than 90% of the material we need in one place, in school platform.
Yes.
So you will not need to dig more and find. You'll find all of them collected in a very nice way, in a very informative way. And honestly, this material was very useful for me. So again, I want to thank Ali and Muhammad for their ongoing efforts for
Yeah,
helping the candidates for MRCS.
And
yeah, Mu'tasim.
we are so happy you passed with us,
Yeah,
Al-Muqtasim.
Mhm.
And we really
Yeah,
appreciate your effort. And I really thank you for this awesome presentation. And we're gonna publish it so everyone can benefit from it.
yeah. I
I
wanted to thank Mu'tasim Ali to take this a
Yeah.
moment to sincerely thank you for your invaluable advice and support in guiding new candidates and colleagues
thank
through
you.
these
Thank
challenges
you
of
so much. I did
MRCSB
nothing,
exam.
And
Your tips,
actually.
yes, and tricks has been incredibly helpful and I have made a really difference. Okay. I
Thank you so
also
much.
appreciate your taking the time to talk about the medicoplasty. Thank you so
yes.
Yeah,
much.
And
thank
we
you.
thank everyone attended,
Yeah,
and we promise you that we're going to continue these sessions to provide you with the free guidance. Thank you, everyone. We're going to upload this. We're going to send the link on the channel. Good luck.
Thank you.
thank you so much,
Thank you.
Mu'tasim.
Thank you. Good luck, everyone. Thank you.